Hi, my name is Lacey Schooley, and today I'll be demonstrating how to prepare medication and administer medication to the patient. So I'm going to perform hand hygiene before I enter the med room. And then I'm going to start by making sure that the MAR I have and the physician's orders are for the same patient. So Shirley Coast, 54 female, Shirley Coast, 54 female, date of birth 5/14/64, 5/14/64. So now I can go ahead and double check that the medications on my MAR match those of the physician's orders. So the first medication is Refresh Plus Lubricant Eye Drops. Refresh Plus Lubricant Eye Drops. Next, I have a fentanyl patch for 500 micrograms per hour. Fentanyl patch, 500 micrograms per hour. Okay, Augmentin, 600 milligrams. 600 milligrams of Augmentin. And then ibuprofen. When I did a vital check before coming here, the patient requested ibuprofen for her leg pain. I see the last time she had it was over 8 hours ago, so I know I'm good to go ahead and prepare that for her. So ibuprofen 800 milligrams, ibuprofen 800 milligrams, digoxin 250 micrograms, digoxin 250 micrograms, and Paxil 20 milligrams, Paxil 20 milligrams. Perfect. So now I am done with physician's orders, and I can start my first check of my medication. So to start, I'm going to make sure that the medication bin and the MAR are for the same patient. So Shirley Coast, female, 54, 5/14/64. So everything matches. So I'm again just going to run through the list and make sure I have all my medications. So Refresh Plus Lubricant Eye Drops. Refresh Plus Lubricant Eye Drops, fentanyl patch 50 micrograms per hour, fentanyl patch 50 micrograms per hour. Okay, Augmentin 600 milligrams. This Augmentin is in milliliters, so it says 400 micrograms equals 5 milliliters. So through dimensional analysis, I know I need 7.5 milliliters to match for the correct dosage. Next is the ibuprofen that the patient requested, 800 milligrams. These ibuprofens are in 400 milligrams, so I'm going to have to get her 2 tablets. Next is the digoxin, 250 micrograms. I have digoxin 0.25 milligrams, and so through dimensional analysis, I know that's the correct dosage. And then the last medication is the Paxil, for 20 micrograms. Paxil 20 micrograms. Perfect. So now I'm going to put on gloves as I prepare the medication. So I'm just going to get this tray so I can bring medication to the patient's room. Okay, so Refresh Plus Lubricant Eye Drops. I just need 1 drop per eye for her dry eyes. So I just need 1 will suffice. Next is the fentanyl patch, 50 micrograms per hour for her pain. Fentanyl patch, 50 micrograms per hour. I'm also going to need an alcohol swab for that. Next I have the Augmentin, 600 milligrams, and then through the dimensional analysis, I know I need 7.5 milliliters, so I'm going to shake that up. Can make sure the label's covered as I'm pouring it. Okay. I'm going to make sure that the bottom of the meniscus is at the 7.5. Perfect. So I can put this back in the bin. So there's the Augmentin for her respiratory infection. The ibuprofen, 800 milligrams. Ibuprofen, this one's 400 milligrams. So I'm going to get 2 tablets ready for her. Okay. I'm going to put this in a separate container in case she changes her mind once I'm in there. That's for her leg pain. Next is the digoxin, 250 micrograms. This one is 0.25 milligrams. I know that's correct through my dimensional analysis. Also going to put this in a separate container because I have to get her heart rate before administering it. And then the last is the Paxil at 20 micrograms day, 20 Paxil, 20 micrograms, perfect. So that one's also going to be in its own container. So then that concludes my second check. So I'm going to dispose my gloves. And I am ready to enter the patient's room. So I'm going to leave this in the med room and enter the patient's room. Knock. Hi, Lacey, I'm going to be your nurse today, okay? We're going to give you your medication. Perfect. So I'm going to perform hand hygiene. Just going to raise your bed up to make it a little easier, okay? Raise the head of the bed, that way it's easier for you to take your medication. Is there any specific order you want to take your medication today? No? Okay. Okay. Just going to get some gloves on before I start, okay? So when in the patient's room, this is when I'm going to perform my third check and explain the medication as I'm administering it. So we're going to go ahead and start with your eye drops. Is that okay? Perfect. If the patient's eyes had anything in them or they were dirty, I would clean her eyes out. With doing that, I would just get a wet washcloth, create my mitt, and wash your eyes, okay? Perfect. Okay, here's a tissue in case you need it. Okay. And then my patient has verified her name and date of birth with me, and that matched her identification band in my MAR. And then I also checked her allergies, which the band and the MAR match. Okay, so with your eye drops, I'm just going to pull down your lower lid and put one drop in there, okay? Pull down the lower lid and create a sac. Perfect. I'm going to do your other eye. Perfect. And then you can use that tissue to wipe it if you need. Okay, so I'm going to change my gloves at this point. Now we're going to do your fentanyl patch. Is that okay? Perfect. So it looks like your old fentanyl patch is on the left side. I'm just going to mark off that I give you your eye drops. Okay. Perfect. I'm just going to lean you up and take that old patch off, okay? So. Here it is. Okay, so it's on the patient's right upper back, so I'm just going to fold it into itself. And then with alcohol swab, rinse the area to make sure I got all the medication off. Okay, I'm just going to have you lean back while I get the next patch ready. Okay, so here I will get new gloves in case any of the fentanyl is still on there. I don't want to touch my pen and anything else. So now I'm ready to prepare the next one. Okay, so I'm going to write the date, which is 9/23, initial, and it is 9 o'clock. Okay. These patches usually stick to you all right? Okay, perfect. So I'm just going to lean you up. I'm going to put it on the left side this time, okay? Perfect. And back. Okay, and I changed my gloves again. And then the last thing is administer the patient's medication. Check off on the patch. Okay. Put it in the left upper, that way the nurse knows. Okay, Shirley, did you want to take all your medications at the same time? Okay, perfect. So we're going to start with the Augmentin, okay? Yep, that's for your respiratory infection. There's that. There's some water. Perfect. Okay, and you want to take all the pills at the same time? Okay, we can do that. Do you still want the ibuprofen for the leg pain? Yeah, it's still hurting? Okay, on a scale from 0 to 10, how would you rate it? 7? Okay. Is there anything that helped or hurt it more? Just the medication? Okay, we'll go ahead and give that to you. Perfect. Keep that printing. Okay, so before I do that, I gotta listen to your heart for the digoxin, okay? Yep, that's for your heart. Okay, I'm just gonna undo the top button, okay? Perfect. Okay, so I'm just gonna listen to the patient's heart for 30 seconds. In a normal clinical setting, I would do this for a minute. Okay, so after 30 seconds, the patient's heart rate is 40. So that means there's 80 beats per minute. So I can go ahead and give you that digoxin, okay? Perfect. Okay, and then the last one is the Paxil. Yep, for your anxiety. Okay, so here's the ibuprofen, the digoxin, and the Paxil. Perfect. Some water. Just gonna initial that I gave those to you. Okay, gave you the ibuprofen at 9. Perfect. Well, that's all I got for you, Shirley. Was there anything else you needed? No? Okay, I'm just gonna lower your bed back down. You wanna stay sitting up to watch TV? Okay, perfect. Okay, and I'm gonna come back in about an hour to check on you. Check on that leg pain, okay? I'm gonna just take off my gloves, perform hand hygiene, and then I will clean up my mess. The patient doesn't need anything else, and then that concludes my video.